Assalamu alaikum. How are you all? So today the general surgeon is again here, and we will discuss about that how to take history from the patient who came with the lump in the neck. So basically, we will talk about the thyroid today. So let's start. Thyroid soiling history taking. Okay. First of all, basic things start with the introduction and take consent of the patient. Then take detailed biodata of the patient, ask about the age, sex, marital status, number of child, each and everything. Then come to the next part, which is presenting complaint. So basically the patient presents with the lump in neck, or sometimes with the neck pain in neck region. So these are the primary complaints. Okay, continue with the history of presenting complaint. So let's talk about the lump first. Okay, first complaint is lump, so let's talk about lump first. So for how long you are having this lump in the neck? When did you notice? How did you notice? How did you notice, or someone else noticed this lump? Ask the patient to locate the site of the lump with the help of the finger. Okay, any change in size? Does the lump has been increased with the period of time, or it's increasing? So in which time span? Like the patient is having lump for 6 months, but the size is being increasing for the last 2 months. So this is very important. Ask about the progression in size. Does it was sudden or gradual in onset? Okay. Then ask about the consistency of the lumps. Is soft, firm, or hard? Okay. And any other lump in body, like the lymph nodes. And what does it cause? Like either it's causing pain, difficulty in swallowing, or difficulty in breathing. So it's very important. Does the patient had any test done, like any biopsy, any ultrasound, any scan, thyroid scan for this? So it's very important. And this patient is having any medications, like if anti-thyroid medications or thyroxine. So it's very important. So let's continue with the further history and ask about the difficulty in solving. Food sticking in the neck. If the patient is complaining of food sticking, then ask the patient to locate the site. Okay. Ask about the stridor. Voice change. Difficulty in breathing. Uh, like if the patient is asked to climb the stairs, how many stairs is he or she able to climb easily? Okay. Ask about the fever. Then comes to the thyroid questions. So ask about the does the patient prefers to lives in a cold weather or in the hot weather? So it's very important. Is the patient irritable and shouts a lot and have anger issues, or the patient doesn't react to all of these questions? So these are the symptoms, like prefer hot weather or cold weather or surroundings. A patient is having a very short temper and having anger issues, but before that he or she was all right, and now he doesn't react to the things and feeling sleepy all day. So it's very important. Ask about the sleep. um, does the patient having increased sleep or irritable sleep nowadays? Concentration issues. Weight gain and weight loss. Then ask about the appetite. Does the appetite has been increased or decreased with passage of time? Ask about the constipation or loose stools. Ask about the tachycardia and tongue tremors and hand tremors. Facial feature changes is also very important, and menstrual cycle changes. So these questions are very important.